Pratibha Shetty, consultant gastroenterologist, practicing at Swasti Chikitsaaya and Manchpal Hospital, Chennai. Today, I would like to discuss about the common problem in our system. Right? It's called the gastroesophageal reflux disease. So, commonly called as acid reflux or reflux disease. So, what is this gastroesophageal reflux disease? In this situation, what happens is the acid in the stomach comes back into the esophagus and it can go up to the throat and cause symptoms of acid irritation in the stomach, in the esophagus, and also in the face, and also in other symptoms of reflux. So, coming to the reflux part, it can be divided grossly into two types of reflux. Acid reflux is very common, and food also gets reflux into the food pipe. So we should let me talk about the acid reflux, which is very common. Here, what happens is the valve between the food pipe and the stomach gets loose, wherein it usually allows food to pass in from the food pipe into the stomach and closes when there is no such activity. But in a patient with reflux, this valve gets loose and the acid gets refluxed back into the esophagus for the symptoms. So, what are the symptoms of acid reflux? Usually, the patient will have a heartburn or any difficulty with their eating food. They feel there is food stuck in the throat. Sometimes this reflux can go right up to the throat and cause a lot of throat irritation and causing a lot of cough, more so in the night times when they lie down. It can also cause chronic sinusitis. It can cause ear dysfunction also. All these symptoms which are not related to the food pipe, which are related to the throat or ears or nose, is called as extraesophageal manifestation of reflux disease. So, coming to the severity of the reflux disease, it is grossly classified into mild, moderate, severe. We have a medical terminology where we grade it from A to B, wherein A is a very mild type of reflux where there is not much of injury in the food pipe, but there are symptoms of reflux, and patient can have intermittent reflux. But as the severity increases, the injury of the esophagus becomes so much that it can cause burst in the esophagus and also cause narrowing of the esophagus, wherein patient may not be able to swallow food and the food may get stuck in the esophagus. So, coming to the causes of reflux. So, the most important cause of reflux is increased acidity, secondary to gastric infection of H. pylori. And the other ones are, they can be diet. Most important also is diet, where when you have certain food like coffee, tea, very spicy or masala kind of food, the sphincter, what we call the valve between the food pipe and esophagus, it becomes loose and there is easy reflux of acid. And other causes which are not very common but still are implicated and are cause for reflux are medications and some systemic disorders which are quite rare. So, regarding how do we go about evaluating these patients with gastroesophageal reflux disease? The first thing is we ask the symptoms. The symptom severity will be scored, and then we go in for investigations. Among the investigations, I would like to touch upon only the important investigations. One of it is endoscopy, where we actually see the food pipe, the J junction, stomach, and also the first part of the duodenum, that is the small intestine. Here, we will be able to assess how much of injury has happened to the food pipe, secondary to the acid reflux, and depending on that, our treatment protocol changes. So, along with this, if the symptoms are quite severe or the symptoms don't respond to our medications, we have even more high-end investigations, which is called as 24-hour esophageal pH metric, where we have instruments or we have gadgets which will help us record the pH of the food pipe over 24 hours and also mark the incidents where the patient has reflux and correlate it with the symptoms so that it will help us managing the reflux. Coming to the treatment part of it, depending on the severity, our treatment changes. So, the first and foremost thing is lifestyle modification. Meaning that this era of our lifestyle being very erratic, we have a suggestion of avoiding all the food and liquids which cause reflux disease. The next thing comes as the medications. For some patients, they may need medications for a short or a long period duration, depending upon the severity. And these are acid suppressants or antibiotics for stomach infection, and also what we call as prokinetics, or those which will increase the movement of the stomach and push the acid down into the duodenum. So apart from this, when the acid reflux is very severe, where the food pipe is totally narrow and food is not passing through the food pipe, we have endoscopic therapies for endoscopic dilatation of the esophagus. These are for rare cases, but definitely the treatment is there. So this is what I would like to inform all of you about topic gastroesophageal reflux. Thank you.